Okie dokie, we are going to be doing the thoracic rotation, kind of like a Russian twist, kind of modified, with some hamstring activation. So what we're gonna do, you're gonna need a mat if you'd like, and then you can use like a Pilates ball if you have that. I'm using this med ball here, because the bigger this is, then the more support you're gonna have for your core. So I'm gonna do, if you'd like, you can put it against a wall as well, but I'm gonna do it here in the clinic without, and that's just gonna be a smidge harder. With your feet set up, I want you to think about like just digging down through your heels, and like as this gets easier, something you can do is again move this back out, take this away, as well as for the legs. If you're starting up close, right, I would kind of go a little bit less than like kind of where you started with your foam roller bridge most likely, and if that's easy, then what you can do is bring that farther out, lift one leg up, and you can switch with each of those. Okay, so that's kind of the setup. You're gonna need a weight, and so if we talked about it, there's going to be one where I kind of ask you, let's first go ahead and dig through your heels, and you're going to inhale, exhale, straight up here. You should feel kind of that deep core, but then mostly what I want you to focus on is that tension through the linea alba, or that tendon where the six pack sits, right? So another thing I want you to pay attention to is, what does your rib cage look like? If we're flared here, I really want you to find your stack, okay? I'm not so much worried about like the tilt of your pelvis, but we really want to find like not so much like forward tilting, because we're gonna probably see a little bit of a flare at the rib cage, okay? So from here, what I would like you to do, if we have progressed, I want you to think about, you're gonna inhale up, but as you inhale, I want you to brace, and I want to find that like deep ab, and that thought of thinking pelvic bone to pelvic bone tension, as well as thinking about, your belly buttons going up to your sternum. First thing you're gonna do, let's set up. Let's put those feet there, dig just slightly ever so into the ground. The next thing you're gonna do, make sure your back's firmly on here. I kind of have like my low mid back on here. The next thing you're gonna do, make sure you're not too far forward, just a smidge of a tuck, right? You're gonna go right back into this ball here. The next thing you're gonna do is you're gonna inhale, but when you inhale, I want you to brace, okay? I want you to find your ab. So you're going to inhale, exhale from here, okay? Again, you can do each side, or you can switch if you'd like, but I would prefer start one side first diagonal. So I'll do the other side, you can see. So I'm gonna start here, inhale, find my ab, exhale. Okay, and I'll do a couple here, really feeling my hamstrings, my core, and a little bit of my arms, going into rotation. So again, inhale, exhale. Again, you can use a lighter weight if that's too hard, or you can use no weight and just practice the motion first. But biggest thing, a little bit of hamstring, not anything crazy, ab, and then you'll feel a little bit of obliques as well, because we're doing some rotation. That's the guy I want you to focus on. Just checking in with your ribs, and then if we're having any bogginess through that midline or that linea alba, I want you to think about, again, the tension that we talk about creating through the deep core and the anterior or front abdominal wall. So again, I'll show you another version. I'm just gonna dig through here. You're gonna inhale, exhale. Okay. And then if we are making it all hard, we're going to kind of rolling back into my pelvis a little bit. And think about, obviously, the lower I go back, the harder it is. And again, with the legs, if I have them on the ground, it's gonna be easier. So again, I'm gonna kind of go into one of these numbers, finding my ab already, and then I think about dragging down into that heel just ever so slightly, just a little bit of contraction through the hamstring. Make sure, check in with your body. We're not clenching our glutes here. Okay, so we're gonna inhale, exhale, drive up, okay? Again, this side, just so you can see, inhale, exhale. And as you do that, I really want you to focus on getting a little bit of that thoracic rotation, that midline tension through your abs, and then that even deep ab in that corner that we always find, okay?